Good afternoon, Chairperson Chavez. I will make you a co-host.
Thank you. I wanted to ask council, do we have council online?
Yes, we do. Tony Lopresti is here.
Oh, great. You know what, Tony, I wanted to, Tony, I'm just going to give you a call real quick.
Hello, Catherine. Would you like to do a mic check?
Hello, good afternoon.
Good afternoon. Thank you. We hear you loud and clear. Councilmember Bracco, would you like to do a mic check?
Hello.
Hello, thank you. Vice Chairperson Allenberg, would you like to do a mic check?
Hey, Nancy, how are you?
I'm good, thank you.
Oh, hello, also Nancy Smith.
Other Nancy. So Susan, I understand you had a marathon meeting yesterday after a marathon meeting the day before.
Yes, and your point?
Oh,
You're not setting me up for another marathon, are you?
No.
Okay.
No.
All right.
Kindness only.
Excellent. Ready to go. Maya, what is your background? It's beautiful. What is behind you?
Thank you. It's the Seven Trees Library and Community Center.
Wow. Is it a new building? I love the architecture.
It's new-ish. It's about 10 years old. So yeah, it's very
So
cool. So
clearly I should
new-ish.
know more.
Yeah. And we also got a big fix up last year with the Golden State Warriors. They went in and fixed up the gym and helped us out a little bit. So
Nice.
very appreciative.
You look all official, Maya.
I'm glad to be
like
here.
a little postcard.
Oh, well, because I have beautiful 7 trees behind me.
Awesome. Welcome.
Thanks. Happy to be here. Hello.
So we're going to just do the 2-minute warning for folks. And my request is if you're able to keep your camera on, and mostly it's so that I'm able to make sure that if you have questions and people look quizzical, that I'm able to follow along. I know not everybody can do that for different reasons, and do what you can there. And just a reminder, just for the purposes of the meeting, we're going to do a roll call vote, call to order, and then roll call vote. Then item 2 is the meat of the meeting. We'll dive into that, and I'll talk a little bit about that, and then we will go to public comment, and that's for an opportunity for people to speak to an item that's not on the agenda. The public can speak on item 2 and item 3, and then we will adjourn. But we have a very meaty meeting, so to speak. And I'm hoping people got a chance to look at their information a little bit. Good. So being 5:30, I'm going to call our meeting to order. And I'm going to ask if folks can unmute themselves so that when the clerk calls your name, you can respond. I'm going to just remind folks that I'm glad to see, I know we have some staff on, including my own, and just as a reminder that we're going to focus on the members, but if you have, and I know you all know that, but I just wanted to say that so people aren't confused with other folks. We don't have alternates on this committee, and in part because the committee was already so large, but I'm very excited to see Christina and others joining that are going to keep their eyes and ears open for others. So with that, I'm going to ask the clerk if you can take the roll.
Member Jordan. Member Jordan.
Here.
Member Haraz. Member Haraz. Council Member Bybee.
Present.
Mayor Stephen Scharf. Mayor Stephen Scharf. Council Member Bracco.
Present.
Mayor Pro Tem Martinez Beltran.
Here.
Council Member Rob Sinks.
Here, my last name is simply R-O-D. Or my first name, sorry.
Thank you, sir. Council Member Dominguez. Vice Mayor Nunez.
Present.
Mayor Lawler.
Present.
Mayor Constantine. Council Member Ramirez.
Here.
Council Member Perales. Council Member Espaza.
Here.
Council Member O'Neill.
Present.
Vice Mayor Smith.
Here.
Mayor Klein. Member Clark.
Here.
Member Reeve. Member Reeve. Member Atare.
Here.
Member Baines.
Here.
Member Franklin. Member Franklin.
Sorry, I was on mute. I'm here, or I was muted.
Thank you. Member Samina Sharp. Member Stepanov.
Here.
Member Cooper. Member Pham.
Here.
Member King. Member Shaw. Member Jerome Shaw. Vice Chairperson Ellenberg
I'm here.
and Chairperson Chavez.
Here.
Thank you. You have a quorum.
Excellent. Jerome Shaw needs to be let into the meeting space. He's on the attendees list. He's out. Yeah, thank you. All right. So, and Jerome Shaw is present with us. So, with that,
I have not been called.
I'm sorry.
I have not been called. Lisa Reeve.
Thank you.
Okay.
Thanks for mentioning that. So both Lisa Reeve and Jerome Shaw are present. Was anybody else not called? No? All right. All right. So because of with feedback from many of you and also feedback from my co-chair, Chairperson Ellenberg, we are going to approach today's meeting a little differently. We know it was a fire hose. We gave you so much information. It was a lot to digest. And we recognize that this is going to be very iterative. We're going to learn while we're talking, while we're doing. So what's going to be a little different about this meeting is that under item 2, there are 3 actions. One's to receive a report from staff. I'll talk a little bit more about that in a minute. The other is to approve the task force's work plan, and then to approve a new meeting schedule that has a new ending date, so we weren't conflicting with the Cities Association activities. So under 2A, here's what the staff is going to do. They're going to do a review, a very high-level review of what we learned last week. Then we're going to open it up for comments and questions. Then what we're going to do is we're going to take a deep dive into what's called the framework. So you can look at all the different kinds of housing options that the staff has already done research on and really be able to compare apples to apples. And then also then we're going to have a discussion, Q&A, preferences, really just better understand what you all are thinking. And the purpose of that, and I just really want to encourage you, there literally is, you can ask any question. Our goal here is really to make sure people have as much information as they can, the best information that we can give you. And frankly, if you ask questions we can't answer, the team can't answer, we want to figure those answers out as well. So with that, I want to turn it over to Consuelo, and we're gonna, like I said, we're gonna be discreet in these presentations so that we can ask questions. I really would encourage you, if you can, if something's on your mind, just to take a note of it, because I think it's better to let them finish the presentations just so we can kind of get the overview before we start jumping in. But then we'll dive right in. We're going to review also briefly the work plan, because I want to talk about the next steps again, just to make sure that we get feedback on those, and then we'll wrap up with any questions. And I'll remind anybody from the public who'd like to speak, you will be able to speak after the presentation of all items under all items on 2, and then we'll go to public comment. All right. So with that, Hillary, am I kicking this off to you or Consuelo?
To me, Consuelo could not be here tonight, but with me, I also have Catherine Kaminsky, who's the Office of Supportive Housing's acting deputy director, and Reagan Henninger from the City of San Jose's Housing Department, and she's the deputy director there. And I will share my screen. So as Supervisor Chavez mentioned, the first thing we're going to do tonight is a review of some of the data points that you saw last meeting. And the first is our point in time count, or our homeless census. And this chart shows data city by city without Sunnyvale being cut off this time, Maritime, and for the 2019 count and the 2017 count. You may remember that based on federal regulations, we do a biennial census in odd numbered years, and we do that count each every 2 years on the last week of January. So the last time that we did a point in time count was the last week of January 2019, and stakeholders throughout the community are now helping us plan the 2021 count that will happen this coming January. And you can see that from 2017 to 2019, throughout Santa Clara County, we saw a 31% increase in homelessness. Our supportive housing system has been doing a great amount of work. From 2015 to 2019, we helped almost 9,000 households move into permanent housing, and that represents about 14,000 people. We've doubled the number of supportive housing and temporary housing units. We had a very successful veterans campaign and launched a homelessness prevention system and passed a $950 million affordable housing bond that has helped us fund 2,400 new apartments and almost 500 unit renovations in 7 cities thus far. So in the 3rd year of implementation of the housing bond, we've committed about $375 million. And even with all of those efforts, homelessness continues to grow. We know from our data that for every homeless household that we are able to connect into housing, 2 to 3 more households are experiencing homelessness for the first time. And we have been looking at this data for a few years now, and this data has helped us inform the community plan to end homelessness for 2020 through 2025. And one of the things that we recognized in the planning process was that the reasons for the growth in homelessness, despite all of the efforts, are systemic factors. We have a growing wealth gap, we have a shortage of affordable homes, and we have racial disparities in homelessness. Our community plan was built on 3 core strategies. So the first strategy looks at those systemic factors, and we address the root causes of homelessness through system and policy change. The second strategy builds on the great work we're doing as a supportive housing system. So we want to expand homelessness prevention and housing programs to meet the needs of our community. And the third strategy, which is the strategy that is most relevant for this task force, is to improve the quality of life for unsheltered individuals and to create healthy neighborhoods for all. And I am going to turn this over for a minute to Reagan Henninger from the City of San Jose to talk more about strategy 3. Reagan and our colleague Chad Bajorquez from Destination Home, who I believe is also on the line tonight, have been charged with helping lead the implementation of this strategy. So Reagan, take it away.
Thanks, Hillary. I'm Reagan with the City of San Jose's Housing Department. I'm the Deputy Director, and one of the things that I oversee is our homeless response and intervention programs. And I had the pleasure of sitting on the working group who developed the new community plan. And
Reagan, can you lean in a little bit? We just want to make sure we can hear you clearly. Thank you. And I also just wanted to let the clerk know that Council Member Dominguez joined us, and I think Council Member O'Neill. Yes, thank you. Oh, Reagan, you're on mute. Sorry, go ahead.
I was yelling at my children. Not yelling, but turn the TV down, guys. Okay, so strategy 3 is what this task force, I think, is really going to focus on and helping us implement this very important strategy of our new community plan. And one of the things that I want to highlight is this pandemic has really required a massive and immediate response by our homeless system to quickly ramp up many of the strategies and sub-strategies in this strategy 3. And some of the things we have done already during COVID that we plan to continue. For example, we have started a county-wide centralized shelter referral, and we do plan to continue that post-COVID. We've expanded in the city of San Jose our interim housing beds by over 300. We have expanded shelter capacity by over 400 beds. There's so much that we've done during COVID that we do plan to continue. But that being said, there's still a lot of work to be done just in this strategy alone. And so you can see here there are 5 main strategies, but each of these strategies have sub-strategies or tasks, if you will. So for example, in strategy 1, double the number of year-round temporary housing beds. Some of the sub-strategies are build new partnerships with public agencies and private agencies to host emergency shelter or safe places to park and access services. Another sub-strategy in number 1 is ensure that all families with children who are unhoused have access to emergency shelter or temporary housing. The second strategy, increase street outreach, hygiene services, and transportation options. There are a number of sub-strategies within this. It is largely focused on basic needs. So I mentioned accessing just basic hygiene, restrooms, porta potties, which we have put out during COVID, but also showers and laundry. One of the other sub-strategies is increasing the number of street outreach teams and case managers who are working with the unsheltered. And this is one area where the city of San Jose, for example, is doing some work. We're using some of our one-time emergency solutions or ESG money to fund some additional street outreach teams. The third strategy, increased mental health and substance use services. Some of the sub-tactics here are increasing the number of beds available for substance use treatment and provide follow-up services. One of the other sub-strategies is to develop a plan to eliminate, to address really service access and address the gaps in treatment. And then the fourth strategy, engage a cross-section of community partners to address the needs of the unsheltered. This also has a number of sub-strategies, for example, engaging the private sector to contribute funding to support kind of health and safety needs, engaging more nonprofits and community-based organizations. One of the things that the city of San Jose has done during COVID-19 is really work collaboratively with a group of homeless advocates and the Lived Experience Advisory Board to help us do outreach to encampments. We have provided supplies, things like PPE and hand sanitizer, and really coordinated with community groups and advocates to help us do outreach. We've done a small meal delivery program to people in encampments with the Lived Experience Advisory Board. So this is kind of some of the things that we mean by engage a cross-section of community partners. And then finally, number 5, ensure that community spaces are safe and welcoming for unhoused residents. This is really where we can think creatively about how do we make our public spaces welcoming for everyone, housed and unhoused. Are there ways that we can use libraries and community centers and parks to make everyone feel welcome? One of the things that the city of San Jose did this past winter was we had, and we continue to do it, is we have street outreach workers who visit some of our libraries in the city of San Jose and are a resource there for some of our unhoused residents that are also accessing other library services. They may be using a computer there or charging their phone there, and we have those street outreach staff there as a way to make connections with our unhoused residents. So even during COVID, we have done a large amount of work in Strategy 3, but there is still a lot more to do. And I will turn it back over to Hillary.
Thanks, Reagan. That is the review that we have planned this evening. And we're happy to answer any questions that anyone has.
Great. So I'm going to ask if there are questions. I'm also going to let the clerk know that Catherine Haraz is also joined us. And so I'm going to go to any of you to put up your blue hands and let's learn together and give feedback and comment. And I'll start with our Vice Mayor, Nancy Smith. Welcome.
Thank you, Board President Chavez. I have had the opportunity to loop in some of our service providers in Sunnyvale, and they have worked with me to identify, I think, about maybe 5 or 6 gaps. And your plan covers many of them. I had a question regarding the transportation options. I did not see specifically things called out in number 2 for transportation. That was definitely a gap identified in Sunnyvale. So I'm interested in what's happening there. And then regarding number 1, I'm wondering what, or maybe I should pause and let you answer.
Yeah, no, you know what, Nancy, if you don't mind, why don't you go ahead and go through your questions? And I do just want to emphasize one thing while Nancy pulls those questions together. Our committee lives in 3. So meaning that if there are gaps, that's part of what we're gonna be able to give feedback to and talk about. So I'm gonna ask staff to be very brief because we've got a lot of questions and I want to make sure we get to everybody's. But Nancy, why don't you finish your questions and then we can let the appropriate staff just take a swing at it.
Sure. So that's number 1, the transportation. It's listed in the description, but I'd be interested in what the sub categories are. The second question relates to any plans there are in terms of temporary housing options throughout the county. I got some very clear feedback that people prefer to have services near where they are familiar with. So for instance, people in Sunnyvale who need some help may not be super willing to go to Gilroy or Morgan Hill. So if there's any thought being given to sort of keeping the services near where the people are familiar. And then lastly, I think the question is under also number 2, I've heard that there's maybe some real gaps in terms of access to digital services. So some of the phones that are provided aren't necessarily adequate to the tasks that people are needing to be to having done today or these days. And then otherwise, these seem to be addressing the gaps that that I have uncovered. So thank you. Those are my 3 questions about those gaps.
Great.
I think in response, I think Supervisor Chavez is right, is that part of what we understand this task force to be charged with is continuing to help identify those gaps and thinking through recommendations to the various jurisdictions within the county, to not only the Board of Supervisors, but also various city councils, to help implement some of the recommendations that you all talk about and bring forward. And so these, I think that none of these things are surprising to me. These are gaps that the steering committee and the community plan process also identified. I think as we've stated things in this slide and in the community plan document, where some of the more specific strategies that Reagan talked about are listed, there is definitely much more detail that we could incorporate into every single strategy.
Thank you. I'm going to go now to Lucas, Councilmember Ramirez.
Thank you, Chair. I guess mostly regarding number 1, I think it would be very helpful to have a baseline to work from. So do we have anywhere a catalog with the existing infrastructure? So the type of shelter or housing, where it's located, the number of beds, the particular populations served. And if that does exist, can you share that with all of the task force members? And if it doesn't exist, how can we help you get that information?
Hillary?
Yes, we do have a what we call a community capacity report, and we report the capacity or inventory of beds to the Board of Supervisors Housing, Land Use, Environment, and Transportation Committee on a monthly basis. We can send and provide that in the with the agenda for the next meeting.
Yeah, and I would say the next meeting is going to allow us to start diving into what's available in different geographies. And so that would be a great overlay, because I think you do need to see it countywide to understand how it breaks down. So that's a really excellent question. Thank you.
Thank you.
I'm sorry, next, Councilmember Esparza.
Thank you. I had a question around number 3. I think one of the things that we've heard on the city council from folks who have lived experience, as well as from community folks, is not just increase the mental health and substance abuse services, but my question is really around how can we facilitate that connection to the services on the other side in real time on the ground, right? So specifically, for example, if someone in an encampment is has been reached out to through peer support or through the outreach team, and they're ready to take that next step, is there a detox bed available to that person so that the outreach worker can take them in? Because it's such a critical window that that outreach worker can take them in. And so that's really my question is, we can increase outreach, but are we looking at the other side of it so that there's something on the other end?
Right, capacity and access. You know, I don't know if Hillary or Reagan, if you want to respond to that, but you know, one recommendation I would make is that perhaps at our next meeting, we have behavioral health come and talk a little bit about where we're at, because I think that's I think it would be important for them to hear the question and, you know, and also give feedback to the entire group. I will say I don't think we're there yet, and that's something that we've been really trying to work on. But I think it would be good to have them come and speak directly to the group. Is everybody okay with that? Because it's such a big question and it's an important one.
I would love it. Thank
Okay.
you.
Yeah, we'll have and Scott, um, the other group we might want to think about bringing to is VTA as well to, at least to have somebody listening as part of VTA. We can talk to Jim maybe about that. Good. All right. Volunteering other people. Isn't that awesome? I'll be so happy. Thanks. Were you done, Maya? Okay.
Yes. Yeah.
Thanks. Anthony?
Yes. I wanted to ask about the number 2 and kind of 3 together. Is there any plan to like have night outreach? And it goes along with my second question around, is there any plan to couple with the mental health and the substance abuse, maybe someone from next door or the YW for people experiencing relationship violence?
Great question. Hillary, do you know the answer to that?
I don't think we have very much. I know there is a little bit of night outreach, I think particularly with our youth-focused outreach providers, but I don't know that there is much focused on other subpopulations. And I think that I think that you all should keep these ideas coming because the ideas are what will create implementation. So yeah, keep them coming.
Thank you. Those were good, great ideas. Next up is Karina, Councilmember Dominguez.
Thank you very much, Chair. My question had to do with a little bit of number 1. And so in the city of Milpitas, one of the gaps that we have been seeing, and I know I've been seeing the past year and a half, is that I'm not too sure like our count reflects our unhoused population and if they're on the waiting list or on the registration list. And so I did see in the PowerPoint that it's shared how unhoused are registered or tagged if, once they make contact to get services. My concern is that our unhoused population are not on any wait list, and I would love to try to fill the gap. And I know we've been trying to do that as a city effort, but we would really want some support from the county in that, just because we do feel that based on our data, it's not reflective of the data that we're seeing. And so we could get some assistance. I'm not too sure who could help us with that, but we're willing to, we just hired a position. And again, we just want to make sure that our unhoused population has been a point of contact already in this process. And so with that, my second question comes with, I would like to understand a little bit how we're working with the schools. Again, in our city, the city of Milpitas has their own system of how they define unhoused families and families that they have identified living in cars and so forth in our community. And so I just want to make sure again that they are already on the list or that they have been touched in some way, shape, or form in our city. So if we could get some assistance with that, I would really appreciate it. Thank you.
Will do, Karina. And Hillary, maybe the other thing we ought to dive into again in a future meeting is the VDOT SPDAT, like the current process that's being used, because I actually think that might help address some of what Karina's Councilmember Dominguez has raised, but also to better understand again that system's really been one that we've been working at, but I don't know if it's working. I mean, I know it's working for like 90%, but like how do we get that last 10%? All right.
Yeah, we can definitely do that.
Thank you. Dr. Pham?
Thank you, Madam Chair. This is a question, but also a comment. I want to thank you for your suggestion to bring the health sector to our meeting next time, and perhaps this can answer a lot of questions that I have. But one comment is, and I'd like to expand on strategy 3, is to make the the health care available to the unhoused, particularly vaccines in terms of flu vaccines and looking into the future COVID-19 vaccine. And also, I'd like to know how the unhoused, how are they accessible to testing at this point? Thank you.
Thanks. Hillary, do you want to start on that? Maybe you or Reagan just could give a little flavor of what's happening now.
Sure. With regard to vaccines like the flu vaccine, there are many medical teams throughout the county who provide medical services specifically for people who are unhoused. The Valley Homeless Healthcare Program is the largest and it's part of the county's healthcare system. And there are also homeless healthcare teams at Gardner, and then there's a clinic in Palo Alto run by Peninsula Healthcare Connections that are specific. And I know that all of those organizations provide flu shots. They have site-based clinics and mobile medical units that go to various areas throughout the county. So there is generally geographic coverage. And then with regard to COVID testing, we are ensuring that COVID testing is happening on a monthly basis at each of the shelters and at each of the safe parking locations. And Catherine, do you want to add anything to that?
Yeah, the VHHP testing team that's testing at shelters is also testing at encampments over 10 people on a monthly basis. So that group of folks will also be providing flu vaccine in addition to the mobile medical units. So there's multiple places that testing is happening, but that testing team that VHHP has is really who stepped up and gotten out into the encampments and the shelters.
Thank you for that. And again, I think these are all really good questions, and we'll figure out how to. I mean, there's much to do. So thank you for that, Dr. Pham. I'm going to go to Lee Clark. I'm sorry. I'm just trying to. I'm getting you in order that your hands went up. So Lisa Reeve, then Lee, then Mayor Lawler, and then I'm going to go to Antonina. I saw you raising your hand, and then I'll go to Jerome. All right. So Lisa.
Okay. I volunteer a lot with a lot of the advocates. I volunteer at Surge. I volunteer with Sleeping Bags for the Homeless and another group that hasn't given themselves a name yet. But I would like to see some sort of a coalition where all of these groups are appointing somebody to meet from each group once a month, because I find that a lot of times we double up and a lot of places are getting over-serviced and a lot of places are not being reached. And I'd like to see a coalition of sorts of everybody from all the advocacy groups that maybe meets with or is able to get in touch with each other, because we don't know if George was serviced here earlier today, or if he needs something or something like that. And this pertains to number 2 as far as getting out the hygiene and resources. Surge was one of the first ones to get out there with some PPE and COVID information and stuff like that. But I would like to see where we're all together on the same page, maybe get a coalition together of the advocacy groups that do the street contact. So the people that are getting overserved or people that are not getting served can be reached. And that's all I had to mention on that.
Thanks, Lisa. Great idea. Lee Clark?
This is on number 2, and then I have something on number 3. And I was wondering, as you say you're going to increase the showers and stuff like that, have you guys consider increasing the showers? Also, maybe a showering facility or a bathroom facility, because there used to be like certain churches that give showers 5 days a week, but I don't think they're doing that too much anymore. And I think that would help a great deal with the people who's out there on the street and in encampments. And also on the mental health side of the thing, you say you're going to increase substance abuse, stuff like that. And I was wondering maybe if you guys could give some kind of stipends to encourage people to take some of these substance abuse classes, and then maybe that might help some of the people get off of drugs or whatever. Thank you.
Thank you, Lee. Hillary, would you mind responding to the shower increases in restroom, or Hillary or Reagan? You're both right next to each other on my screen, so there you go.
Sure. So we have showers were definitely one of the bigger hits